A health alert tonight. A possible salmonella or bacterial outbreak is being investigated in Accomack County after a local hospital reported an influx of emergency department visits related to a foodborne illness. Leila Cox joins us in the studio with the latest from local health experts.
That's right, Janet. A Riverside Health spokesperson says the Riverside Shore Memorial Hospital in Accomack County had dozens of people in the past 72 hours visit the emergency department with foodborne illnesses.
You are consuming these bacteria all the time, but your immune system is just awesome at fighting them off. But with a big enough dose, the healthiest, youngest person is going to have terrible, terrible, terrible illness.
Leaders with the Accomack County Health Department say a large group of people potentially contracted salmonella or another type of bacteria at a private potluck-style event. This comes after Riverside Shore Memorial Hospital reported 52 patients walking into the emergency department with, quote, food-borne infectious diarrheal illness. A Riverside Shore Memorial Hospital spokesperson says those patients visited the emergency department between Sunday and Tuesday. According to the Centers for Disease Control and Prevention, or CDC, salmonella cases are more common in the summertime. Experts say a combination of warm weather and unrefrigerated foods can cause salmonella bacteria to grow. Riverside Shore Memorial Emergency Medicine Dr. Ryan McAtee says foodborne illness symptoms are highly noticeable.
The nice thing about dangerous foodborne illnesses is that they are not a silent disease.
Diarrhea, fever, stomach cramps, and muscle aches are common signs one could be dealing with a foodborne sickness. But McAtee says there are several ways you can protect yourself from foodborne illnesses.
One, hand hygiene. You got to be washing your hands while you're preparing food and, before you eat it. And the second is in the preparation. Bacteria thrives at middle temperatures, 140 degrees to 40 degrees Fahrenheit. And so you need to do everything you can to keep your food out of that range.
Other prevention tips include the use of separate cooking utensils to prevent cross-contamination, plus the proper storage of hot and cold foods.
Dr. McAtee also leads the infection prevention team at Riverside Shore Memorial Hospital and says the influx of patients dealing with foodborne infectious diarrheal illnesses are still in recovery. Leila Cox, 13 News Now.
All right, Leila, thank you. And Eastern Shore Health District Health Director John Richardson tells 13 News Now the department conducts an epidemiological investigation to determine the appropriate course of action for salmonella and other bacterial outbreaks.